I can confirm we're now live.
Thank you very much indeed. Thank you. And good afternoon and welcome to this first local outbreak engagement board of Bracknell Forest of the new year. And I'd like to wish everybody on this meeting, both those participating and those who might be watching, a very happy, healthy and successful new year. Colleagues, firstly, do we have any apologies for absence, please?
Chair, I've received apologies from Kelly Williams and Abby Thomas.
Thank you very much, Kirstine. Thank you. Should we therefore have a roll call of members who are here?
Thank you, Chair. As is sometimes the case, people can have problems accessing a digital meeting, so anyone who doesn't appear in the call will have their apologies recorded. Members of the board, please turn on your microphone and confirm you are present when I call your name. And as I said before, anyone who doesn't respond will be recorded as giving their apologies. Councillor Dr. Barnard.
Present.
Councillor Bettison.
Present.
Councillor Birch.
Present.
Councillor Brunel Walker.
Present.
Andrew Hunter.
Present.
I've received apologies from Abby Thomas and Kelly Williams. Elena Rozelle.
Present.
Gabby Hafner.
Present.
Acting Inspector Sophie Gardner. I'll record apologies for Acting Inspector Sophie Gardner. Fiona Slevin-Brown. I'll record apologies for Fiona Slevin-Brown. Philip Bell.
Present.
Tim Whedon.
Present.
Thank you. Shamaki Issa.
Present.
Councillor Mrs Hayes.
Present.
Jerry Barber.
Present.
Is there anybody else on this call whose name I have not called?
Hello there, it's Councillor Hayden speaking. I'm attending.
Thank you, Councillor Hayden. I'll record your attendance. Chair, that concludes the roll call.
Thank you very much indeed. Thank you, Kirstine. Right, colleagues, with that takes us to agenda item 2, which is declarations of interest. And I should ask if anybody has any disclosable, pecuniary or affected interests to declare at this moment in time. And nobody is indicating, and so I'll just issue the usual caveat that should any debate take an unexpected turn and anyone realise that there is an interest that should be disclosed, then please feel free to interrupt proceedings to disclose that interest. Thank you, colleagues. Kirstine, do we have any urgent items of business?
Chair, no, there are no urgent items of business.
Okay, fine. That's great. Then we'll move straight on to agenda item 4, which is the national and local COVID-19 status. And I believe that's to be introduced by Gabby and Shamaka.
Thank you, Chair. My colleague Shamaka is going to present it because he's our Public Health Intelligence Lead. Okay,
fine. Thank you, Shamaka.
I'll just share my screen. Hope you're all able to see that.
Yes, indeed.
Okay, thank you very much. Welcome to the latest EPI update for the local outbreak engagement board. Beginning off with our situational awareness, we have the latest data up until the 26th of December. So the current status for Bracknell Forest, Berkshire, and the southeastern England is present here in the form of the situational awareness indicators. Beginning on the left-hand side with the individuals tested per 100,000 for not only Bracknell Forest, but for Berkshire as well as southeastern England. The individuals tested with PCR per 100,000 is down across all of these different areas, whereas the percentage of individuals testing positively for this period has gone up. What's particularly of note is that compared to the previous 7-day period, the percentage of individuals taking PCR tests and testing positive has gone up to 25.7%, which means that more than 1 in 4 individuals for this period being tested with PCR in Bracknell Forest are testing positively. That's up 52% from the previous 7-day period. And this isn't just isolated to Bracknell Forest. If you look down the other areas, whether that's the other Berkshire local authorities as well as the southeast in England, we are seeing numbers approaching, getting near to a quarter of individuals being PCR tested during this 6-day, 7-day period, testing positively. If we move on to the cases per 100,000 population for Bracknell Forest, that was on the 26th of December, 1,440.8 cases per 100,000, representing a 29% increase from the previous 7-day period. If we compare that number with the other areas, with other local authorities in Bracknell Forest as well as southeast of England, we see that other than for Windsor and Maidenhead, it is the highest case rate per 100,000 for that population. Moving on to the cases per 100,000 isolated to the just 60 and over age group, we're seeing again massive increases, not just in Bracknell Forest, but also across the local authorities in Berkshire as well as southeast in England. Compared to the previous 7-day period, the cases per 100,000 in the 60 plus population is 97%. It's up 97% from the previous 7-day period. If we compare the Bracknell Forest number with the other local authorities, we see that other than exactly that this number is higher than all the other local authorities, as well as when compared to the southeast England, this number being significantly higher. So moving on to just an overview of the situational awareness in Berkshire again, the weekly rate at the 29th of December is 1,420.3 cases per 100,000 population, which represents a 17% increase on the previous week's number, which is 1,209, and a 69% increase on the prior week, so the 15th of December, that number being 841.6 cases per 100,000. If you have a look at this graph showing the increases in the weekly COVID-19 confirmed cases per 100,000 from the 1st of June up until the 28th of December, we see that not just for Bracknell Forest, not just for Berkshire, which is in blue, but also for the southeast, which is in orange, and England in grey, we're seeing the cases significantly increase from this 14th December period up to the point where it's 1,420 cases per 100,000. If we then move down to actually look at the cases in the individual local authorities, we're seeing a similar picture across the 6 local authorities where from this 14th of December period date, cases massively increase, not just for the individual local authority, but also for the southeast and the England averages. What is particularly sticking out is that for Bracknell Forest and Windsor and Maidenhead, both having a more steep increase in cases over this 2-week period compared to the other local authorities. Nevertheless, we are seeing an increase in all these individual local authorities, more or less in line with what we're seeing nationally and regionally in the southeast. If we look at situational awareness maps for the southeast as well as for Bracknell Forest, we are seeing that every single individual local authority in Berkshire as well as the adjoining regions are showing more than 500 cases per 100,000. 500 cases per 100,000. The reality is this number will be significantly higher as this is only covering up to the period of 16th of December, showing that the Bracknell Forest or Berkshire aren't isolated cases, but that this is pretty much the same picture regionally. If we go down and look at the individual wards up until the 16th of December, every single individual ward is showing cases of 500 plus per 100,000. The reality is that number no likely will be double for each individual ward, given that this is up to the 16th of December. If we actually then move on to looking at case rates by individual age groups for the period 23rd to 29th of December, which is the latest 7-day period that we actually have numbers for, We're seeing that firstly, looking at this image, which is a heat map of the number of cases per 100,000 for each individual group, where 800 plus represents the darkest numbers. We're seeing that from 0 to 4 all the way up until 65 to 69, that individual groups are showing more than 800 cases per 100,000, which is quite different to the picture shown in the previous local outbreak engagement board EPI updates, which showed much lower numbers. So the three highest rates at the 23rd of December are in the 25 to 29 group, showing 3,129 cases per 100,000, which is up 20% from the previous week, the 22nd of December. Over 3,000 cases in the 20 to 24 group, which is up 15% from the previous 7-day period, and the 30 to 34 group showing, which is up 6% from the previous group. Other age groups of notably high case rates are the 35 to 39, 40 to 44, and the 15 to 19, showing between 2,059 and 2,250 cases per 100,000, with the 15 to 19 age group showing the highest increase in terms of percentage from the previous week. So what we're seeing is that in previous months, where the school age groups, which were the 5 to 9 to 15 to 19 group showing the highest rates, we're now almost seeing a reversal where for this period, the highest rates are very much in the 25 all the way up until the 44 age groups and higher. A actual breakdown of the numbers for Bracknell Forest and Southeast for the 23rd to 29th December compared to the 22nd of December, we're seeing not just the high case rates in Bracknell Forest in the Southeast, but also the significant increases in terms of percentage compared to the previous week's numbers. I've put the case rates for the individual age groups in Bracknell in bold, where they are significantly higher than the numbers in the same age categories regionally. And we're seeing that for each individual age category, other than the 5 to 9, 30 to 34, and the 85 to 89 group, that the numbers reported in terms of case rates in Bracknell Forest are significantly higher than the numbers in the Southeast at the 29th of December 2021. Moving on to hospital activities and deaths. Despite the fact that the overall numbers of individual patients presenting increasing at hospitals, the numbers of individuals admitted to hospital with COVID-19, those that are staying as inpatients in the Frimley Health hospitals, as well as the numbers that are on mechanical ventilations, have very much remained stable over these past few weeks. The situation could change in later weeks, but up until the 26th and 28th of December, the numbers are very much stable over that period, over the past few weeks. So at the 26th of December, there were 11 new COVID-19 admissions to hospital. And by the 28th of December, 92 patients were currently in hospital with COVID-19, with 9 more patients on mechanical ventilation. Moving on to deaths, up until the latest period that we have data for, which is the week ending 17th of December, there was only 1 more new COVID-19 death recorded. The total number of COVID-19 deaths during the pandemic for Bracknell Forest is 208. If we look at all-cause mortality rates, since the beginning of the pandemic, the all-cause mortality rate has been 9% higher for Bracknell Forest compared to the previous 5-year average, which equates to an additional 163 deaths during the pandemic. To give an overview of the vaccination status in Bracknell Forest up until the 19th of December, we're seeing that for the total number, that 77% of individuals aged 12 and older at the 19th of December have had both their dose 1 and their dose 2. Compared to the other local authorities in Berkshire, it puts us very much in the middle. We are outperforming Reading, Slough, posting the same numbers as the Royal Borough, Windsor and Maidenhead, with West Berkshire and Wokingham outperforming us by 3 and 4% respectively. But if we compare this number, the total number of individuals who've had both doses compared to the Southeast in England, we're actually doing a lot better. Moving on to the estimated population coverage for dose 3 or boosters by local authority and age group up until the 19th of December, Bracknell Forest again is doing quite well with 76% of individuals aged 50 plus having received their third dose or their booster, which is very much like the dose 1 and dose 2 in the middle, sort of in the middle of the pack in terms of local authorities in Berkshire, with West Berkshire, Royal Borough, and Wokingham outperforming Bracknell Forest, but with Bracknell Forest outperforming Reading and Slough, which are the larger local authorities within the county. Compared to the South East England numbers, we're pretty much on par with the South East England, achieving 77% coverage of their 50 plus population for those 3 and boosters. I've also included 2 maps for COVID-19 vaccinations for all individuals aged 18 plus who've received at least 1 dose and at least 2 doses. Looking at all the individuals who've received 1 dose, we're doing really well in Bracknell Forest in that 80 to 89% of individuals in most of the wards aged 12 plus have received at least 1 dose, with only the central ward showing lower numbers, but those numbers being between 60 and 69%. If you look at individuals who've been vaccinated with 2 doses aged 12 plus, we're seeing that the overall picture is that between 60 and 69% of individuals aged 12 and over have received both doses, with particularly these individual wards showing the better performance, with 80 to 89% of individuals having had both doses. These numbers are quite heavily skewed by the fact that individuals between 12 and 17 are still in the process of getting their first and second dose. Finally, there is another slide in here which explains the individual colors in terms of data thresholds for the situational awareness that you can refer to should you want to understand what the colors mean. And finally, for more information, please see slide number 14. And that concludes my presentation. If there are any questions, I'm happy to take them.
Thanks very much indeed, Shamaka. Thank you. Colleagues, does anybody have any questions? Feel free to jump in because I can't see. Mark, yeah, your hand's up.
I put something into chat, and thank you for the detailed and horrific presentation. I remember when we discussed this 18 months ago, at the start of all this, when it was first mentioned that we'd need to change the colour scheme because of the rise in rates. And when you now look at that table and all you can see is purple, it's a massive concern for me. It's a massive concern for everyone, obviously. But what I wanted to do is ask a question. Come back to me if you want to. But on the vaccination charts, can we see the data for the under 50 age group broken down into, that slide? Can we get that data for the under 50s broken down into groups? I think, there's part of me that says actually now it's about the shock of saying to people, look, this age group has got 3 people that have been vaccinated, or whatever the percentage is, but yet it accounts for X% of positive cases. And I just think there's maybe time of shifting it, because you see that we have a particular challenge of the highest percentages is in that 20 to 34 age group. The under 51, it's great to see actually that in the other ones we're at or above a regional national average, but I just think there's a game change message that might need to come slightly harsher into that group that says, what percentage is unvaccinated compared to what's the ratio of unvaccinated to vaccinated in the infection rate in that lower category. Does that make sense?
That makes complete sense. Essentially, you've got the under 50 groups which are showing lower numbers, and in order to actually show that, compared to the other age groups, there needs to be an increase in terms of boosting, given that that under 50 group represents the largest groups in terms of the infections, the cases. And that should be possible. I will sort of need to investigate that for you, but that should absolutely be possible to break that down into smaller age groups so we can have an actual more accurate view of the groups.
Yeah, and I think, to be fair, it's just the under 50 age group, because I think we can see when we look at all the rest of the data following kind of the first dose, second dose, and then booster doses, actually the upper age groups, the vaccination rate is not not so much of a challenge. It's in that lower age group where we probably need to break it down and actually focus more attention there. And I think, from a harsher message, I mean, anecdotally, four of my son's friends went to a nightclub in Reading on New Year's Eve. They managed to have COVID negative tests that went in, and all four of them since then have now got COVID positive tests, and one of whom's had to delay her return to America by a month. So I think there's something in there that says we need to probably change the messaging to be slightly harsher. I mean, that's probably an Elena conversation, but I think having that data and showing people that data is probably a better thing.
No, absolutely. I think the only sort of thing I would add is that given that the data that we have was up to the 19th of December, I do believe that the 2-week periods afterwards, you'll see quite a big change given the drive to get people vaccinated and all the effort put in. So I will have a look at breaking that data down for you and providing that information for you. And I think hopefully that 2 weeks on from the 19th of December that we'll see much higher coverage for that group. But yes.
I'm happy to wait to get that data if it's going to tell a better story. It's not something for tomorrow, but because of the lag, it will be better to wait. So yeah, thank you.
Absolutely.
Thank you very much. Colleagues, is there anybody else with any questions? I can't see anybody else indicating, so thank you.
Oh, sorry, just a general question again, and apologies. When we track back to previous peaks, our performance relative to our neighbouring authorities and the local and national average hasn't been quite as, I don't recall it being as different or as divergent as it is now. That slide there, I don't recall it being so different to the other Berkshire regional or national pictures in previous peaks. Do we have any indication of what is it just rapid spread across the community and that's just the way it is, or is there any way of drawing any intelligence as to what's caused that the divergence in the trend graphs that we've had from before? I think it's more evident on the chart page. And that's a question for anyone, sorry, not particularly you.
Sorry, go ahead. I think Gabby put her hands up. I think she might have
Gabby,
response.
yes. Do you have a response to that?
Yes, I think there are a number of theories. You may remember back in September, we led the way then again, actually. And I think some of that was due to the fact that we have a great relationship with our schools and they were very diligent in their testing and reporting. I think part of that has carried on. So we sort of led to the unfortunate high levels in Berkshire at the moment. But also there have been some exceptionally high numbers in parts of Surrey. And I wonder if our border with Surrey has, some of the cases have bled across from there. And that's what's showing us having such high levels. My colleague Shamaki was presenting at CMT earlier, and we were discussing why Slough actually has lower numbers at the moment. And obviously in the past, they and Reading have had exceptionally high numbers. And one of our theories is perhaps there's, a small amount of sort of herd immunity there, which is why they're reflecting lower numbers now. Although there is increasing data in that the current cases, 10 to 15% of those are reinfections. So people who have previously had, say, Alpha or Delta are now testing positive with Omicron.
Worrying,
Okay.
but thank you.
Thank you. Thank you. Councillor Mrs. Dorothy Hayes.
Sorry to come in on this, but it was something I was just watching with the new variant that's coming in from France as well, stating we will be watching this very closely, won't we? I'm sure we are, but it is quite worrying.
Yep. Okay, thank you. Well, okay, thank you very much to Shamaka and Gabby. Let's move on then to agenda item 5, which is the communications and engagement update at a national and local level. And I believe that that's to be introduced today by Elena.
Thanks, Chair. Yeah, bear with me 2 seconds. I'm just going to...
We've got you.
Just try and make it a little bit bigger. There we go. So since we last met, actually quite a lot has happened. We met just over a month and a bit ago, but actually quite a lot has happened in that time in terms of numbers, as we've just seen from Shamake and Gabby, but also lots of rule changes have come into play, and we've had Christmas and New Year. So in terms of comms, it's actually been quite a busy time trying to get lots of quite complicated messages out and making sure people are prepared for the festive period. So one of the big priorities for us for comms and engagement was testing, and that will continue to be a priority going forward, specifically around meeting up. If you're meeting up with friends and family, especially indoors, then please test beforehand, and promoting where and when to get those tests over Christmas. Our test sites were open pretty much throughout the festive period, just very small closures, I think Christmas and New Year's Day. So there was lots of opportunity for people to go and get those tests. So we just made sure we were promoting those as much as we could. And our engagement team were helping to get that message out to local communities, as well as using the new normal communications channels. We had to break down some of the new rules around self-isolation and making it very easy to understand. The test to release information came out quite quickly just before Christmas, and it was quite complicated. So we needed to make sure that people understood that they had to take a test on day 6 and day 7, and they both have to be negative for them to actually be released from self-isolation. So we worked to make sure that was on our website and across all our different channels. And we used pictures as well to make that as easy to understand as possible, because those rules were quite challenging and a break from what we're used to doing. So some behaviour change work there. We're working on increasing publicity around what tests can be obtained from which centre. We understand that over the Christmas period that some people were turning up to One Lexicon for PCR tests, when actually that is the sports centre. So we're just revising our communications now to make sure that that is as clear as possible, because we obviously don't want symptomatic people turning up at the test centre to collect lateral flow tests. And we've continued to promote the mobile testing unit down in Sandhurst as well, for people with symptoms. All of these have been across our usual channels, including e-news, social media. We've used ad vans, we've used radio adverts, we've used A-boards and posters to get that out as widely as possible. In terms of vaccinations behaviours, we've launched some new assets around that. I think we've previously spoken at the board about how we need to keep these fresh in order to stop them becoming like wallpaper, so people take notice of them. On the right-hand side there, you can just see an example of some of the assets that we've used. We've ramped up around promotion around face coverings, specifically because the new rules came into place. And we've had promotional events actually giving out leaflets and information, talking to people, but giving out face coverings to people who didn't have them. We've also got some new translated materials available on our website, and we've distributed them via our community engagement team to some of our groups who prefer that information in alternative languages, just recognising that not everybody in our community does speak English, and some people prefer to understand it through peer-to-peer information or through assets with images. We've got a new leaflet produced, which is aimed at younger males. Traditionally, that's been an audience that we've struggled to reach. It includes information on behaviours and how to get a jab if they haven't had their first or second COVID jab, how to go and get that, and to get their booster as well. That's been distributed again via our community engagement team to local barbers, pubs, restaurants, bars, places that we know that audience frequents. Over the holidays, we've continued to promote the rules around things like testing and ventilation, just because we know traditionally, again, it's a time when people mix up a lot indoors and the risk of COVID increases because people are mixing, and it's not outdoors that they're mixing it, it's generally indoors. So we made sure that we had those messages in place and that they were across all our channels. And we've also promoted how to get boosters in general, as well as what the local offer is. And that's been through booking an appointment, but also the walk-in vaccination appointments at the Waitrose site between Christmas and New Year. This is just a slide with some examples of the new assets so that you can see that we're doing something slightly different just to keep it fresh. And then in terms of engagement, I've touched on what some of the team have been doing, but they've also been working with communications leads, and they've been trying to identify those communication needs across different communities at a borough level, but also within ward levels, because we know that people test and people vaccinate differently across the borough, but in very specific pockets as well. So our engagement team has been working very closely with those communities, and they have secured buy-in from a number of different communities, which you can see on the screen. And those communities are now sharing those messages with their contacts on vaccination, testing, and different behaviours, just to help their understanding and reach, and also to get their feedback. If we need to do something differently to help them understand, if they need information from us, what can we do to make it easier for them? That's really a whistle-stop tour of what we've been doing over the past couple of weeks, but happy to take any questions.
Thanks very much indeed, Elena. Thank you. And it's good to see that your guys seem to have been very, very busy. And we appreciate that. Thank you very much indeed. Colleagues, are there any questions for Elena? No? Then fine. Thank you very much indeed, Elena. And we'll move on now to agenda item 6, which is public participation. Kirstine.
Chair, we have received a question from a member of the public. The question reads, as at 29th of December 2021 in Bracknell Forest, positive cases of COVID were up by 42.8% against 41.4% in the UK, but testing up to the 28th of December 2021 was down by 37.9% against 5.2% reduction in the UK in the last 7 days. Vaccinations of the over 12 population in Bracknell Forest up to the 28th of December 21 stood at 84.4% first dose, 77.9% second dose and 52.1% booster dose, which are also lower than the UK averages of 89.9%, 82.3% and 57.5% respectively. Despite being at the point of what has been described as a tsunami of COVID cases, Bracknell Forest is behind the national averages on both testing and vaccination. What actions will be taken to improve these figures? A written answer has been provided by council officers and the clinical commissioning group, which will be published along with the accompanying documentation for this meeting. The written answer states, thank you for submitting a question to the Local Outbreak Engagement Board. As different rules and guidance apply to each of the devolved nations, Bracknell Forest Council usually benchmarks against England, South East or Berkshire data for testing and vaccinations. For example, the national dataset published online at Vaccinations in the UK, Coronavirus in the UK Gov data, the link will be published in the published document, says a different denominator is used for England local areas and age demographics by vaccination date, so these cannot be compared. As far as testing is concerned, rates of testing do fluctuate, particularly around school holidays, and to some degree it depends on the availability of PCR test kits and slots, especially in times of high demand. PCR testing operations, bookings and the location of PCR testing sites are operated by the Department of Health and Social Care. We are fortunate enough to have a facility within our borough located in the car park of Bracknell Leisure Centre. Other PCR testing facilities are available locally in Maidenhead, Slough and Reading. Bracknell Forest Council has also supported PCR testing by providing locations for mobile PCR testing units. There's information on testing locations available via the gov.uk website, and our communications team regularly supplements this with detailed information for local people across our channels and via a range of mediums. This includes electronic channels like e-news, social media, as well as hard copy information like newspaper ads and all household leaflet and newsletter drops. Lateral flow devices can be collected from pharmacies by post for home delivery when ordering from the gov.uk website or from locations established by Bracknell Forest Council. Our locations are focused on supporting underserved communities and groups disproportionately impacted by COVID-19 in line with current government policy and are reviewed regularly. The Council also provides guided lateral flow testing 7 days a week in Bracknell Town Centre. We've provided a link to the location and opening times in the published answer. Again, this is supported by a network of ongoing communications, even over the Christmas and New Year period, working in tandem with the National Publicity Campaign. In respect to vaccinations, COVID-19 vaccinations are provided for our residents by Frimley Integrated Care System, ICS, and include the vaccination centres at Birch Hill and the Waitrose Sports Centre. While the ICS is the lead agency for vaccinations, the Council supports local health organisations to encourage vaccination uptake of both the COVID and flu vaccinations, and will continue to do so via a range of communications, marketing and publicity, as well as directly with harder to reach groups via the Council's engagement team. We're currently working with NHS colleagues on locations for the vaccine bus that we hope will be in our area next month. For at least the last 2 months, Frimley has consistently been in the top 2 ICSs within the South East region for booster uptake per percentage of eligible population. Bracknell Forest Council will continue to support the DHSC on testing and Frimley ICS on vaccinations. Communications and engagement for testing and vaccination will continue to be reviewed and tailored according to local intelligence and rates of vaccination and testing update. Thank you, Chair.
Thank you very much indeed, Kirstine. Thank you. Colleagues, does anybody have any questions on that that question or its answer? No, I don't see anybody. So, Kirstine, thank you very much indeed, and I'm sure you will thank the member of the public for their question.
Certainly, Chair.
Thank you. Colleagues, agenda item 7 is to, by exception, review the local outbreak engagement record, the action log. Is there anything exceptional to report?
Chair, the only open item on there is for members of the board to notify the board of any false or fake news articles so that it can be addressed and countered with accurate information. All other items on that action log have been answered and published.
Fine, thank you.
Sorry, can I just make a point? And I'm not sure, but I probably should have raised this under the Elena's update, but I'm not sure where it sits. When you look at social media, and you know, as you know, I've been kind of in enforced rest over the last 3 weeks. The biggest kind of content that seems to come out every day, the biggest number of asks every day is, does anyone know if X, Y, and Z is offering X, Y, and Z injections? Or does anyone know where I can get a walk-in today? Does anyone know where I can do this? And then increasingly over the last couple of weeks, as testing capability became, the ability to pick up tests became a bit harder, anyone know where I can pick up X, Y, and Z test? What I see is multiple different responses from different people who work at Waitrose, for example, in the vaccination centre, from the varying health groups, there are so many people trying to give a message out that says, do this, go here, do that, be this. And, you know, when you're trying to look at comms and trying to get a message out, that clarity and purity of the message and purpose is really important. And it just, is there an easier way of telling people from public health, from doctors, from whatever, today you can go here, this is what you could do? Because on 2 of the local groups, I must have seen 10 or 15 posts in the last couple of hours from people going, can I get a walk-in still at X, Y, and Z? And I think there's people out there that either don't know where to search for the information, can't be bothered to search for information, but go to social media, which is, you know, a great place to go for information in some of these groups. But I don't know, it just feels to me that we need to be better, or there needs to be a better response, probably not from us, about explaining where to go for the walk-in, or Waitrose is doing walk-in, or Woking is doing walk-in, or Slap, whatever, and actually really kind of staple gun into people's heads about where they can get that information from and where they can go.
Elena, do you want to take that one?
I'll try. So we share a lot of information from our CCG colleagues because they run the vaccination programme. So unfortunately, we don't have that sort of real-time information to hand. But what I can do is take that away and speak to my CCG comms colleagues and see what we can look to do to improve that, if that's a genuine sort of concern in the community, and see how we can.
Yeah, and I think to be fair, it's not necessarily real time as in instantly needing it now, but I think from the CCG perspective, I think what's needed is like a single source of truth about what's going where and everything else, or from whoever. Sorry, I can see Tim's got his hand up as well.
Yep, Tim.
I was going to say, what would be really helpful if Councillor Brunel-Walker, if you could actually give us the evidence of these different sources,
sure,
then we can begin to combat them.
Yeah,
sure, absolutely fine.
You know, at the moment, it's a bit like wading through treacle. If people are putting
totally
information up, there's nothing to do with us or the CCG.
Totally agree.
Yeah. Actually, I must say that just yesterday, I was looking at a similar request. Might be one of the ones that Councillor Brunel-Walker was mentioning. And I looked at the different answers that well-meaning members of the public were putting in, and it was interesting that the questioner on this occasion had come back about an hour later and said that they'd followed up on one lead where a lady had said she'd been into a certain shop and they had loads, so why not go there? But it struck me at the time that the problem is, of course, that information is fine while that shop still has loads, but 100 calls later and they might not have any, and then somewhere else that didn't have any in the morning, if they have a delivery at 11 o'clock, by 11:15 they'll have them out available. Yeah, it is interesting. I can it would be wonderful if somebody knew where they were being delivered to.
It's more of an observation of people who I think are incredibly well-intentioned and well-meaning, sharing information. I mean, our local pharmacy in Crowthorne, when I was queuing for half an hour to wait for something, must have had about 20 phone calls, half of which the answer was no, sorry, we've run out. And I think it's well-meaning, well-intentioned people. So I'm not criticizing anyone that's not a criticism. There's well-intentioned, well-meaning people, and I don't know.
Yeah. Well, maybe
wills get tested, wills get boosting done. I mean, that's the great thing.
Yeah. Okay. Well, thanks for raising that, and let's take a look at it. Thank you, colleagues. Is there any other business? And if not, can
Councillor Barber has his name. Yes, Councillor Barber has his name.
Jerry, did your hand was up? Was it? Yes, it is. Jerry Barber.
Thank you, Chair. I was just going to say, from the MP's office, we have had similar inquiries about availability of different vaccines, mainly being the AstraZeneca one, because people can't always take Pfizer for medical reasons. And Fiona Sleven-Brown, has been extremely helpful on that. So credit to the CCG. And I think the other one, in terms of testing and availability of lateral flow tests, I think one of the observations to bear in mind is that, having spoken to a number of chemists, they are limited to the number they can order each day. And that's a relatively low number, and it doesn't take long for those to go. But we also have to recognise there is a national shortage of availability of these at the moment, because there's an international demand for these lateral flow tests, and it's a question of just manufacturing catching up with the supply chain. But I think the most important thing is making sure that the schools have all the test kits they need to make sure that we keep children in schools, and that's got to be a priority at the moment as well.
Yeah. Okay. Thanks very much indeed, Jerry. Thank you. Right. Colleagues, the date of our next meeting is the 1st of February at 4 p.m. Unless we need one in the meantime, in which case you'll be given due notice. But that concludes the business for today, and I'd like to thank you all very much indeed for your attendance and participation. And as always, I'd like to thank you all for all the work that you're doing behind the scenes, and that I know continued all the way through the Christmas and New Year break. So we're very grateful to you. I'm very grateful to you on behalf of the public that we're all serving. And I look forward to seeing you all again soon. And thanks very much indeed.